My name is Dr. Pagdin, and my specialty is anti-aging and regenerative medicine. The science of stem cell medicine is still in the early stages, though. So a lot of the stuff is just primary research. Some of it is observational trials and small groups of patients, that we're starting to see these kinds of reports coming out in the literature. But because it's been around for almost a decade now in traditional medicine, we are seeing some papers now that are showing evidence of 10 years of follow-up. Patients that have been treated, say, in 2005, now followed up 10 years later. So there's really some good stuff emerging in the medical literature. These procedures that I perform are still considered to be experimental, however.
I went to an orthopedic surgeon, and because right away they said, we have to do a double hip replacement.
Well, my challenges are basically, all my life I've been into sport and really love it, and I feel it's important to do it till my dying days. And I've been a runner, played football all my life, soccer, badminton, you name it, any skiing, all the different sports you can think of. So when I got to the age of about 56, my knee started playing up, and basically it stopped me being able to run. So that meant really stopping me doing most of the sports that I love to play.
I've had continuous knee pain for a number of years. I've had both knees scoped, and the right one is my main problem, which I've had done twice.
I'm an active person. I do a lot of things like skiing and biking and stuff like that, and having knees that are sore is challenging when you do those kinds of things. Mm-hmm. And I use my hands for various things, and I knit is one of the places where I found the thumb thing.
So I wanted to try to devise a method for addressing some of these problems, and the options, unfortunately, are rather limited. So people are faced with options such as injections of cortisone, injections of a visco supplement called hyaluronic acid, or orthopedic surgery. And the first two options, the injections, are providing only very temporary relief. And unfortunately, until recently, there hasn't been a lot that we could do to try to reverse degenerative arthritis. So this is really where my interest in stem cell medicine as a tool for regenerating some of these degenerative conditions came about.
Well, like I told him, I've had massages that have hurt more than his treatment for the knees. So, because I made the decision to go for the full thing with the stem cell treatment as well.
It wasn't the most pleasant experience in my life. I've had better experiences, but it wasn't unbearable. It's short term. Let's say compared to childbirth, it was a piece of cake.
I got on YouTube and I searched out hip replacement. And when I watched what they do to you, I didn't want them to do that to me.
So I've had injections of not just platelets, stem cells and platelets into my right and my left knee, and just platelets into my thumbs, I think.
Now, ever since I've started this and got this going, I've been talking with everybody, and a lot of people are interested.
So the type of patients that come to me interested in stem cell therapy are patients that really would prefer to avoid having a major joint reconstruction orthopedic surgery, and they're looking for some sort of a stopgap measure that's somewhat better than the other alternatives that we have on the market so far. So there has been some very interesting research comparing the platelet-rich plasma versus cortisone, shows that platelet-rich plasma is superior. And there's been studies comparing platelet-rich plasma versus the hyaluronic acid supplements, and again showing that platelet-rich plasma is superior.
My first treatment was probably about 4 or 5 weeks ago, and from all what I've read and what I've been told, they'll normally do 2 treatments. The first one is where they use the fat and the platelets. That sort of creates the medium inside the knee. Then after that, it's more of a top-up. They top up with the platelets.
So far, minimal change. I'd say if anything, my left knee, which has been the easier one to deal with, has been slightly better. The right is still giving me similar type of problems. So.
The timing was that I want to go skiing this winter, and I want my knees to be cooperating with me. And season officially opened this weekend. I know I can't ski yet, but I'm thinking maybe next weekend, depending on what Dr. Pagdin says, that I will try it. Yes, he treated the thumbs, and the improvement in my thumbs, I think, is quite a bit more than than I expected it to be.
I couldn't stand 6 weeks ago, now I can, and I actually can walk. I get a little sore, I use my crutches until my legs loosen up.
So this is really the whole anti-aging kind of practice. It deals with nutrition, it deals with appropriate levels of fitness, and sometimes an actual fitness prescription. Deals with things like stress reduction and relaxation, as well as getting appropriate sleep. And we focus even on trying to develop healthy social relationships as a foundation for health. The next piece that we add on is specific nutritional supplements that can try to address certain areas of deficiencies or enhance some of the biochemical values that we're seeing in the labs, trying to move things towards the optimum end of the spectrum. And then really the icing on the cake, oftentimes these folks will have declining levels of hormones as they age, which is a natural process, of course, but we know that nothing good happens in your body from declining levels of hormones. So if you really want to optimize your performance, sometimes we start talking about hormone replacement therapy. So these are the kind of patients that come through my door. They're patients that are prepared to pay privately for a consultation that is a much more comprehensive treatment package than what they're going to be able to obtain through the medical insurance program.
Oh, exactly. So if I get a reasonable degree of results within the time frame of 3 to 6 months, like they say, and I thought that I needed more, I might try another session for sure.
And as I said, my knitting kind of became really a little difficult, but right now it's a lot better. I don't have those kind of don't do this again movements. I can do it great.
I think it's a much better option to deal with this as opposed to cutting you open to do surgery and stuff. I'm more up for this process for sure.
It's worth, if you're in pain and there's something going wrong with your body, it's worth exploring if you can afford it,
6 weeks ago, I couldn't stand up, could not stand up straight. I was all hunched over and that. Now I stand up straight, and I'm amazed with it. I still hurt. I know there's more to go. I know that it takes 6 to 9 months. It's not an instant heal. It takes time for your body to regenerate itself.
When I play soccer a lot, I used to be able to kick the ball very hard, but because I kick on my right foot, my left knee's gone, I struggle to kick. The last few games I felt I can actually start kicking the ball a bit better. So maybe it is a sign, it's hard to say. But
in order to connect with me, a patient doesn't have to have a referral from their own family physician. They can give us a call and arrange an appointment to sit down at no cost to discuss the possibility of some regenerative medicine for their arthritic joint. I like to see some imaging of the joint, either some x-rays, CT scan, or MRI. I also like to see a basic blood panel that shows their hemoglobin and their platelets. I just like to make sure that they have enough hemoglobin and platelets to be able to tolerate donating a few. And so once we've had a chance to discuss with the patient the options, the alternatives, and the risks, then we have a look at the images and the blood count and make a decision about what would be the most appropriate package in terms of giving the best options of regenerating that joint.